Welcome back to Your Face Unfiltered. I'm Dr. Keith Ladner, double board certified facial plastic surgeon. And today we are going to go through one of my favorite patient transformations. We have a lot of favorite patient transformations, to be quite honest, but I think this is a really good one for this particular procedure. So this patient was a 31-year-old female, so beautiful young lady who felt like she never had the jawline and the neck contour that she desired. She reported to me that this was a heavily genetic trait, that a lot of her siblings and family members, parents also had similar appearing necks, and she just wanted to show off really a nice natural but better jawline contour, jawline definition. So in this individual, she underwent what I call minimally invasive neck tightening. Minimally invasive neck tightening has a lot of other names based on different surgeons, different websites, etc. It can also be referred to as a direct deep plane neck lift. It can be referred to as a submenoplasty, a platysmoplasty. I don't always like the platysmoplasty and submenoplasty vernacular per se for this procedure because it doesn't completely in its entirety describe what we might actually be doing during the procedure. So for this individual, she felt like specifically she had a receded chin and she had an obtuse angle in her neck and always had fullness in her neck. She felt like if she gained a little bit of weight, it got a little bit worse. If she lost a little bit of weight, it got a little bit better, but that really didn't solve her problem. So clearly it wasn't just a fat issue, stubborn fat in the neck issue. So in this individual, she underwent a few procedures, but all through a very small incision underneath the chin, which is why I call it minimally invasive neck tightening versus the more standard deep plane neck lift, which is going to include incisions that go behind the ear. She was young enough at 31 that we knew that she had really good skin elasticity, that whatever contour improvements I made underneath the skin would then match those changes and show off the results. So very akin to a weight loss. So for a 31-year-old that undergoes drastic weight loss, they're going to see the skin really kind of coapt and shrink down to that nice contour change that they made in their body. And the same is true for our patients that don't want to have necessarily a bigger incision than they need. And so through a small incision, we know that their skin is going to match what we achieve at the time of surgery. That process can take about 4 to 6 months to occur. So in her, we performed a chin augmentation. We performed a little touch of submental liposuction. And as I always counsel my patients of all the things we're going to do, if I do recommend submental liposuction, that's going to be the least important of all of the procedures that I'm recommending. And so that offers about 5 to 10% of the results at most. We also did a platysmal tightening. So we tightened the muscle in the neck. And what that really does is it acts like a sling so that it can really tighten the deeper structures as well underneath that muscle. And then finally, we removed a decent amount of what's called subplatysmal fat. So that is the more important fat pad in the neck, which is why places that offer just submental liposuction alone, they pretty much always fail in terms of delivering good results because they're missing the majority of the fat which lives underneath that muscle. So she underwent the chin augmentation, the muscle tightening, the fat removal, and primarily the fat removal behind her muscle. And so this is one of my favorite procedures because it can literally be done in an hour, hour and a half or less. And as you can see in the photos, give quite a drastic transformation and still look very natural and deliver that jawline that she wished she always had. So that's it for today's patient transformation. If you like what you heard, please be sure to like our video and subscribe to our channel.